Do you suffer from the debilitating symptoms of chronic pain, swelling, and loss of joint motion due to arthritis? Are you taking drugs like Celebrex and Vioxx or other super aspirin prescriptions? If you are, you're increasing the risk of heart attack and stroke by up to 50%. This is Dr. Tom Roselle, host of Dr. Tom Roselle Live Sundays at 12 noon. Why live with pain or the dangerous side effects of drugs when the doctors at the Roselle Center for Healing, practicing 21st century integrative medicine, can help you experience relief like never before? Simple, safe, chiropractic, acupuncture, and nutritional care can provide significant relief from arthritic pain in less than 6 weeks. More than 70% of our patients experience a return to life far beyond their expectations. Give yourself the best gift possible, freedom from arthritic pain, naturally. Call today to schedule an appointment. Call 703-698-7117 or visit online at rosellecare.com.
Dr. Tom Roselle Live, right now, on 105.9 FM and AM 630 WMAL.
Welcome to Dr. Tom Roselle Live. This is Dr. Tom Roselle, live in studio. It's beautiful outside. What a gorgeous day. Matter of fact, I had to come in with the top down in the car. It was just absolutely stunning, beautiful, and you need to be out there playing. That is, after you get done listening to the program, of course, and you learn the things that you need to do. You've had a problem, and we're going to teach you how to fix it. You tried and applied and come up with the same old things that don't work. Well, here's an opportunity to make sure that you find out what can work, and that's why we do this program. Give us a call at 888-630-9625. That's 888-630-9625. Love to talk to you on any subject that you have in mind, and we have one today that I think that you're going to find fascinating. But more importantly, the fascination comes in the presenter, and you have heard this doctor many times, and we all know that he's a bright, incredibly intuitive, and keeps me honest, unfortunately, on a day-to-day basis. Dr. Harlan Browning.
Good morning, Tom. How are we?
I am far better right now than I was an hour ago.
Yes, I think we should tell everybody that I had to do a little triage with you in the office because your hip was bothering you, but I think we got it back in order.
I am functional, thanks to you. Yes, it's been, that's what I get for running around with my grandchildren and, thinking that I can work and move as quickly as they can, but nevertheless, I am back to normal. Thank you very much. I appreciate it.
Well, it's good to hear that. It's funny because patients always ask me, well, who takes care of you? And I usually say, well, whichever one of the docs has time to, because they're all great and they all do different things, but they get the job done.
Absolutely. And trust me, this morning when I tried to get out of bed, I was sitting there saying, I am in trouble. So I called you up and I said, by the way, meet me earlier because I need some help. And you gave me the help that I need, and I feel better. Thank you very much.
You got it.
888-630-9625. We're going to talk about chronic neck pain, what it is, what it isn't. And that's going to be the topic of our in-house continuing education program this Wednesday, August the 7th, 7:30 p.m. And obviously, Dr. Browning is going to be your presenter. Love to talk to you today, and we'd love to have you as our guest. And all you need to do to attend is call 703-698-7117, 703-698-7117. Tell our staff that you'd like to be there, and these are always our gift to you, to the community, absolutely no charge whatsoever. And we do this because we need to educate you. We want you to understand that you have options, you have choices, and there's ways of fixing almost everything that happens. And this is a subject particularly that we get ourselves into trouble with and we don't know what to do. We treat a lot of professional athletes. We treat unprofessional type of athletes like me and folks that are in between. But all of us sometimes come up with neck and shoulder pain that goes into the arms often and sometimes up in the head and gives us headaches, and it just doesn't go away no matter what we do. And matter of fact, Dr. Browning, we're going to get to them, not right now, but our first call coming in is about that type of situation. So we'll take that in a little bit, but let's talk a little bit about this enigma, if you will, neck pain. My neck is sore, I don't feel good. It can be anything from environmental to traumatic to organic to many different things, but let's kind of distinguish. How do we know? Let's start with the fact that we have neck pain. Now, when we talk about neck pain, we talk about neck and radiation in the shoulder and all the things that are attached to that. But how do you distinguish different characteristics of the pain? How do you know that it's bone, it's nerve, it's muscle, it's organic?
Well, certainly when a patient comes in and they explain the problem, did it just happen or has it been there for 2 years, 10 years, 2 weeks? The length of time gives us a lot of indication. If it's a short-term thing, in other words, the person just injured themselves, maybe lifting something up, then it certainly could be a sprain or strain, which is basically a polite way of saying we've torn something, be it a muscle or a tendon, sometimes a ligament. In certain cases, if the pain refers from their neck down the arm, then we're going to open up our possibilities and look at maybe a disc that's bulging or a nerve that's getting compressed. And then for those folks that say, Doc, I just had this problem. It gets better, it gets worse. It's not, it's not a deal breaker, but it's always there. Then I'm thinking more degenerative changes. Maybe the disc space is breaking down over time. Maybe they're developing some arthritis in there. And one thing we don't hear talked about in medicine a lot, which is a big deal, is the ligaments in our neck and our low back get thicker over time because they get abused. But as they get thicker, they take up room. And if they take up room, then they're going to start to encroach on other sensitive tissues, specifically the nerves.
So not just the disc, but we can have soft tissue also that hypertrophies.
Yes.
And scar tissue and so forth that gets in there and causes the problem.
Certainly, or we can also go to the flip side where we get tissue that actually atrophies or gets smaller. Specific, very tiny muscles in our low back called the multifidi, and especially small muscles in our neck that work more to support the neck and to keep vertebrae in tight parameters of position. They get weaker, and if they get weaker, then the vertebrae shift out of their position, and usually that's globally. In other words, when we see a curve in the back become straighter, that's a pretty good indication that those little tiny muscles are not supporting it. And over the long haul, that's setting a person up for failure. In other words, multiple areas of the spine are going to break down just because we don't have the curve and we don't have the cushioning that we should.
One of the things that we get back and makes me crazy is reports from radiologists that says the x-rays are completely normal. And we look at those x-rays, those same x-rays, and that x-ray doesn't have a curvature, or the curve is very minimal. Now, why is that such a big deal if at least at that moment in time the disc spaces look like they're adequate?
Two things that I can tell immediately when I read a report and then actually look at the film: the length of time that the radiologist has been in practice, or their appreciation for normal mechanics.
How's that?
So I find that the older guys, they'll make reference to the curvature, either a straightening of the spine or a reversal of curvature or a positional issue. They'll certainly use terms that we are very familiar with as far as biomechanics. The younger guys, or the guys that don't appreciate the importance of those spinal dynamics and those curves, will not make reference. And very often you'll have an x-ray up, and I can take a straight edge or a ruler and just put it along the whole length of the cervical spine, and it's poker straight, and there's no reference.
Yeah, they used to call it military spine,
right?
A ramrod or rigid neck. And the truth of it is that the neck should have an easy C-shaped type of configuration, which opens to the back. And it does it mechanically simply because the weight of the head and the biomechanics of the pull of the abdomen and the other things that are lower down put a strain on that disc space. And it should be where, if you do the right markings on the x-ray, that the weight, the gravitational effect, should end up on the back of each one of the bodies of the vertebrae, not into the disc space itself. And that's where we run into trouble.
Yeah, certainly, and that's certainly what sets us up for problems in the neck. And if we take that one step further, and if we see a straightening of the cervical curve, the way the body compensates for that, because we've lost our center of gravity, we're actually moving it forward, we're going to actually have to have a greater curvature in the upper back. So we call that increased kyphosis. You'll see that the people bent over. And then to compensate for that, we're going to often develop more of a curve in the low back. That's the sway back or the lordosis. So we can knock down all these bowling pins starting from the top all the way to the bottom just because our curves become straighter in our neck.
Truly a domino effect.
Yeah, and very often a person's low back problem is ultimately because of their neck issue that maybe was not even problematic. It was not a pain situation. It was just a matter of fact that the person always holds their head very far forward.
Well, we know that the spine balances itself, and it has pivotal points. And one of the things that we call our reciprocal movements within the spine, that means if something happens at one end of the spine, there has to be a compensation someplace else. We know that the first vertebrae in the neck moves with the last one in the spine, and the second with the fourth, and so forth. And it goes back and forth. And these are areas that where one can affect the other. So we know that neck problems can come from the low back, and low back problems can come from the neck. 888-630-9625. That's 888-630-9625. That's how you reach us here, and to ask whatever questions that you'd like on this subject or anything else. But we want to remind you, this Wednesday evening, August the 7th, 7:30 p.m., Dr. Harlan Browning will be your presenter at our in-house continuing education program on chronic neck pain, what it is, what it isn't, but more importantly, how to fix it. Would love to have you, and if you have a problem, gives you an opportunity to ask questions. These are for you. We put these online. By the way, you can go into rosellecare.com, ROSELLECARE, and there's other in-house programs that are there, old ones that you can go back and revisit on many different subjects. But in the meantime, let's take one of these calls because it looks like it's going to be matched up to something we're talking about. Dennis, thank you very much for calling. How can we help you? Let's talk about your shoulder.
Yes, good morning. 2 months ago, experienced just difficulties in certain positions in my shoulder and kind of chalk it up to older age. It's almost 64. And it progressed to the point that I literally lost motion, went to my doctor, and did scans and basically said the aggravation was severe and I had frozen shoulder. And they gave me a cortisone shot on the spot and gave me therapy as a recommendation. And I guess I'm looking for more information. Is there anything I can do to avoid another attack like this?
Well, let me ask you some quick questions.
Sure.
First of all, what's your range of motion like in the shoulder? Can you reach up? Can you reach back? Can you reach in front? Or is it limited?
It's limited and with great difficulty.
Has there been any injury to your body, car accident, falls, anything like that within the last even 10 years?
No, not really.
Okay. Dr. Browning.
Yeah, Dennis, so frozen shoulder, or what's called adhesive encapsulitis, when we actually get these adhesions or scar tissue that forms in the shoulder itself, is most of the time what we call idiopathic. We're not so sure why it starts. Certainly there's situations where a person says, Doc, I fell on my shoulder, it caused a lot of pain, and the pain kind of went away, but the range of motion never came back. But in cases like yours where we don't have a trauma, a couple things that I really look closely at. Number one is how well does the scapula move? The scapula is your shoulder blade, and it moves across the ribs. The scapula, at one portion of it, has a hole where our arm bone meets it. So if we don't have good motion in the scapula, it becomes next to impossible to have us be able to lift our arm up. There's a muscle underneath the scapula called the subscapularis, and what very often happens is it becomes basically stuck or gets sticky to the rib cage itself. So we lose the ability for it to move across the ribs. When we start to develop pain, then the body protects itself by having muscles splint and get tighter. So now we have this reciprocating event. We get more pain, more tightness, more sticking to the rib cage. So slowly over time, we lose that motion. So the first thing I always look at is how well does that scapula move.
Dennis, let me give you an insight in how we look at any shoulder. Now remember that as Dr. Browning's talking about these muscles that misfire, don't fire in the way that they're supposed to, that will allow the shoulder either to move or to stay frozen. Those things move because of other circuits in the body. Now, the shoulder muscles move because of the nerves from the neck, cervical 5, 6, 7, T1, thoracic 1. Those go to that area. So if any of these nerves are being irritated, they're being stretched or they're being compressed because of narrowing of the disc spaces or other types of factors, the shoulder muscles are not going to work. They're not going to fire the way they're supposed to. There's acupuncture circuits that go there. In our specialty of applied kinesiology, we respect the relationship between organ systems and muscle, and the organ systems that are associated with several of the shoulder muscles have to do with the lungs. The muscle that Dr. Browning was talking about, the subscapularis muscle, has to do with the heart. And so we look at all those connections. Doesn't mean that there's significant pathology, just means that the energetics of this area may not be working the way they're supposed to. So the bottom line is, yes, there's a whole lot more than you can do. Your shoulder should not be frozen. You should be able to move that without any problems, particularly when it's just something that comes on. There always is a why is that. There always is a reason that these things occur. And I'd love to have you as our guest this Wednesday evening. Come on over. You're close. You live in Vienna. Spend the evening with us. And by the way, I can't let you get away with 64 being old because we're in the same ballpark and I don't have your problems. Anyway, we'll be right back after some very important messages. Don't go away. You're listening to Dr. Tom Roselle Live.
Did you know that routine mammograms can increase radiation exposure to breast tissue 1,000 times over a chest X-ray? Now consider a simple, non-invasive, and totally safe medical procedure approved by the FDA since 1982 that can detect breast cancer 5 to 8 years before it can be visualized on a mammogram. Infrared thermographic imaging can accurately detect the initial signs of breast cancer as increased blood supply and metabolic rate, which is recorded as heat. Why expose yourself to radiation when accurate and safe medical detection is available? Call the Thermography Center of Fairfax to schedule a breast exam today at 703-948-7248. That's 703-943-7248. For more information, visit www.thermographyscan.net. That's thermographyscan.net for the Thermography Center of Fairfax.
The Roselle Center for Healing is a proud supporter of breast cancer awareness and reminds you to conduct a monthly breast self-examination and a thermographic breast scan as part of your annual wellness checkup.
This is Dr. Tom Roselle. After 35 years of practice and almost 750,000 patient visits, the Roselle Center for Healing knows what works and knows how you can take control of your health and wellness. My team of doctors practice 21st century integrative medicine. Whether you suffer from chronic pain and fatigue, allergies, or headaches, we can help. Take charge of your health before it's too late. Make an appointment today. Call 703-698-7117 or visit online at rosellecare.com. This is Dr. Tom Roselle, author of Ageless Health. Health is a do-it-yourself program. My book, now also available in audio version, is a step-by-step program of how to take control of your health and wellness without drugs or needless surgery. You have the capacity to change your health and level of well-being. Take control of your health today and order Health is a do-it-yourself program.
For more information and to order, please visit agelesshealthbook.com. That's agelesshealthbook.com.
Welcome back. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle Live. Yep, we're in studio. Loving to take your phone call, 888-630-9625. That's how you find us. Give us a call. And by the way, how you find us off the air. You know, you want to send me a note or any of the doctors? Go to rosellecare.com. That's ROSELLECARE.com. rosellecare.com. And take a tour around. By the way, that's a great website. You can go into our alternative website, which is drtomroselle.com, and you can see all the information for your learning pleasure and sign up for our email, where there's free emails sitting in there where we send you blogs, and we have a blog site. Ask me a question. Go there that way to do it as well. I answer everything personally, and we'd like to invite you this Wednesday evening, the 7th of August, 7:30 p.m., where Roselle Center for Healing in Fairfax. What's the topic? Chronic neck pain. What is? What isn't? And Dr. Browning will be your host, your presenter. Dr. Browning, Dr. Harlan, the professor. Let's talk a little bit about the subject called neck pain, why it's there, how come it doesn't go away. But as we get into this and we talk about the differentiation between the pieces, why do people end up with neck pain when there's no apparent reason that they should have neck pain? You know, they're just doing whatever. At least for them, there's no apparent reason.
You know, I think probably the most common reason people develop neck pain is just a lack of awareness of how they hold their head. Maybe that's at work, you know, working at a computer, maybe lying on the couch and propping their head up with 3 or 4 pillows, watching TV, you know, a football game for 4 hours on the weekend. As we do that, the tissues in our neck accommodate for that. Certain ones get longer, the ones in the back of our neck stretch, and the ones in the front get tighter, including the muscles of the chest. So we slowly shift forward, and as that happens, then we slowly have things break down, and then we get to a break-even point where we start to develop some sort of sensation. Maybe it's just tightness in the beginning, or maybe it's pain or an ache, or in some cases, if it's significant enough, we compress a nerve and we have radiating pain all the way down or into the arm or the hand.
How can we get people that show up with degenerative disc disease? They have never really had a major trauma. in their life. We'll take an incident. Somebody's in their 40s, okay, 45, 46, 47 years old. They, said, have you had any injuries and so forth? And the short answer is no, they've never had any major injuries. But the next question is, there's been a lot of injuries over time, but they're not aware because they think it's normal life. How do you begin to show people, listen, you actually have been hurt and you've never been taught to take care of it properly?
Well, you got to break down what an injury means, and to me, a change in posture is chronic injury. So, in other words, if they're working 8-10 hours a day sitting in front of a desk, that's a small amount of injury on a daily basis, and depending on how many hours they work a week, that accumulates. Certainly little bumps and bruises. We hit our head up in the crawl space of the attic. We've all done that. We hit that beam. We know it's there. But we still hit our head on that. Just things like that over time traumatize the spine. And as we traumatize it, then the side effect is it's going to slowly degenerate. Certainly if we start to lose the curves, those natural shock absorbers, then we're going to transition the weight-bearing portion from the joint itself, and that's what it's designed for, and that's what makes it healthy. When it bears weight, that's what it thrives for. It's healthy for it. But when we shift that weight-bearing anteriorly or forward onto the disc, we start to run into trouble because the disc is not designed to hold us up like that, and it's not designed to work like a joint itself, but unfortunately that's what it'll have to do. So it breaks down, and as it breaks down, we see the side effects that typically bring people into my office and certainly into your practice as well.
Well, we see patients that come in and, going to this enigma of, I've never been hurt, I don't know why it's there type of thing, but even gait patterns, people are walking. We know that the bones in the foot are balancing acts for the head. And if those bones in the foot are not aligned properly, if people aren't walking the way they're supposed to, if their toes are being crunched, or if their heels are too high, if their arches are dropping down, then the balancing act of the neck muscles also have a compromised situation.
Yeah, so as you know, I have this love of neurology, and when we step back and we really look at how neurology impacts our health, it's a huge umbrella that dictates what goes on. Specifically, in what we see on an ongoing basis with neck issues or any musculoskeletal problem, is the body has parameters to keep us upright. The eyes being one of the most important ones, visual writing, and then we have inner ear mechanisms to tell us where we are in space, and then we have a whole series of receptors, which are kind of like thermostats in our joints that tell us where we are. There's tons of them in our neck and tons of them in the little tiny muscles in the back of our head. So as those become overloaded, then the balance becomes compromised.
And then we get neck pain and shoulder pain and head pain and facial pain and all that kind of stuff. And not to mention bad dentistry, which we'll talk about when we come back. Coming up to a break and the news. Don't go away. You're listening to Dr. Tom Roselle. This is Dr. Tom Roselle Live, and you're part of it. We'll see you in a minute. Welcome back. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle Live. We're in studio. It's beautiful outside, but we're here for you, and you get to go outside and play after you listen to the program. Either that or turn it on in the car or take your headset with you so you can listen to us. In studio with me today talking about a very interesting subject called chronic neck pain. Interesting why? Why? Because many of you suffer from it, way too many of you, millions and millions and millions of people that just kind of put up with it, take aspirin, my shoulders ache, my neck's sore, I got a headache, it radiates down to my arms, my fingers tingle, and you deal with it on a day-to-day basis. Not necessary, but you have to understand the mechanism, and that's what we're talking about today. And then this Wednesday evening, August the 7th, 7:30 p.m., Dr. Harlan Browning, my guest today in studio, your host on this very specific subject. If you'd like to attend, call our office at 703-698-7117, 703-698-7117, and register because we have limited space, and once we're filled up, we're filled up. So that's the deal. Dr. Browning, let's talk a little bit about, we know that neck pain can come from all kinds of things. Jerking of the neck, if you will, that's called whiplash. Whether it's a car, whether it's a fall, or whether you fall asleep and you drop your head down, you can't hang your head up. Stenosis, herniated discs, areas that in chiropractic we call subluxation, osteopaths call spinal lesions, vertebrae being misaligned for a lot of reasons, muscle imbalance, You get into the gym and you go a little too hard. You play tennis too quick, too strenuously, racquetball or any of those things. Those are all injuries. Even, skiing, like you like to do.
Sure.
So let's talk about the inflammatory problems of arthritis when it comes to neck pain. How do we distinguish? Is it the egg or the chicken?
That's actually a really good question. I would actually say it's probably the chicken, for whatever that's worth. Degeneration is common, but it's not normal. So we need to get that out in the open first of all. We're often told that we should take aspirin and Advil for our normal headache or our normal pain. So I don't.
What do you expect for your age?
Yeah, I don't agree with that. I mean, certainly there's lots of folks that have those problems, but that doesn't make it right. When we start to have degeneration in a joint, and the neck is like any other joint in the body, it's very similar to your knee. There's two surfaces that meet, and they're separated by a space, and there's cartilage that buffers it, and there's a fluid in there to make it very slippery, so there's not a lot of friction. As that breaks down, then the surfaces approximate or get closer, and then they start to rub. The byproduct of the rubbing is the actual hyaline cartilage breaks down, and it releases these mediators of inflammation. And what they do is these inflammatory markers tell our immune system there's something going on, so our immune system goes in there to try to repair it. Unfortunately, because our immune system is often in a rush to do this, it repairs it by laying down either scar tissue or new bone, and that's what we call arthritis. And when we lay down scar tissue or new bone, it's not as smooth as what was there before. It's not as strong, and it's certainly not as viable. So we often see the byproduct of that, and that's the ache or pain or the stiffness or loss of range of motion or maybe a combination thereof.
Well, these pro-inflammatory reactions that the body goes through are natural patterns, natural ways the body's fix things. The problem is when the inflammatory pathway gets out of hand and continues over a period of time, that's when we see the destructive process that begins to unfold. But in light of that, and the same parallel can be drawn to heart disease really coming about because of inflammation, and now you have all these guys out there saying, well, take 81 milligrams of aspirin every day the rest of your life. But when it comes to arthritic conditions, good or bad?
It's probably bad for several reasons. Number one, all of those NSAIDs or nonsteroidal anti-inflammatories, they compete for sulfur, and sulfur is one of the constituents that makes up connective tissue, specifically what's in our joints. That's why when people have arthritis, they'll often try things like glucosamine sulfate, so there's the sulfur, or methylsulfonomethane, so there's sulfur in there, or those types of things. So as we compete for sulfur, then the new tissue that's built, and that's either the scar tissue, like I said before, or the degenerative arthritis type tissue, is just not very strong. It's almost brittle.
So what happens is by taking these NSAIDs or these aspirins, that they compete for the same receptor, if you will, the same site that the sulfur or the sulfate ion goes to, and blocks it, so subsequently potentiating, making worse the degenerative condition, degenerative disease that's underneath all of this.
Right, and I think it's important to say that inflammation is important on the short term, but we don't like to see it on the long term. As a matter of fact, another chiropractor, good friend of mine, Dr. Matt, I'll throw that out there, give him a little PR. He sent me over an article the other day that was actually looking at using ice after injury, and the author cited several reasons why you probably want to consider not doing that, because it changes.
The worm is turning.
Yes,
on that.
So things are starting to change. So they're looking at, well, maybe if we ice things, we're not going to control the inflammation in a proper manner, and we're not going to have regenerative type tissue being formed. We're going to push more of that scar tissue. So I'm not saying don't ice. I'm just saying now we know that inflammation is really important, so we need to manage it on the short term and prevent it on the long term.
Actually, intermittent icing along with expansion contraction due to heat and circulation is probably the best approach,
yes,
but it has to be done the right way. If you get into that type of situation, you really need to know what you're doing, and if a doctor says just go home and ice it and keep it under ice, it could be doing a lot more damage than they can helping you, and you need to look at that. But that's the problem. You have these small injuries that take place. Let's talk about this enigma called the vertebral subluxation. And years ago in our profession, when they called a subluxation, they said that, this is the vertebrae out of place, pinching the nerve, crushing the nerve, and that's why you have pain or loss of function. We know today that that definition is incorrect, that pinched nerves do occur in the spine, but they only occur in a couple different places, really, where you can get straight bone on nerve root, or the result of when the nerve gets crushed because of the loss of disc height, and then we go to stenosis, and that will cause it as well. But the actual subluxation that can occur in the neck is, in any place, as a misalignment, millimetric misalignment, that causes loss of motion and loss of normal function, subsequently leading to these things that we're talking about, the degenerative changes that occur, the overstretch in most cases of neural tissue, the breakdown of the joint space globally, and then the problems we're talking about.
Yeah, and one thing that we want to add with folks that have chronic neck pain, or for that matter, chronic pain in general, as you said, that subluxation causes localized changes. Well, it also causes global changes. I don't think we appreciate enough in medicine, let alone in the general public, the importance of what the spinal cord does. The spinal cord's main responsibility is to take a lot of burden off of the brain. In other words, it's going to make decisions so the brain doesn't have to do it. Specifically, it makes decisions on how the muscles that surround the spine contract and relax to keep us stable and to allow us to move. So as these subluxations or these millimetric misalignments start to develop, we start to bombard the spinal cord with all this nonsense information. So the spinal cord has to make quick decisions, and very often those decisions are poor, which is unfortunate. So as we continue to do that over the long time, we get this centralized sensitization, which means that the spinal cord just gets caught in this loop and it doesn't get out of it. So very often folks with chronic pain syndromes start as a person that has lots of joint issues in the spine itself that very much confuse the spinal cord. So the spinal cord just waves the white flag and just perpetuates the issue. And that's often outside of the fact that there's very often no longer anything there that should be causing the pain. So the person has pain, but there isn't anything that should be causing it.
It's almost like a phantom phenomenon.
Exactly. So phantom limb would be a great example of that. Now that's pretty significant, and there's something called wind-up that's involved with that as well, but that's basically what it is.
Now you're getting a neurology class. And I'm going to have to interpret everything that you say.
Yes, you probably will.
Yes. If you'd like to attend Dr. Browning's presentation this Wednesday evening, give us a call. Love to have you there as our guest. All you need to do is call 703-698-7117. That's 703-698-7117. Tell my staff that you'd like to attend. And listen, this program's for you. We structure these in-house continuing education programs, continuing education for you, so we can make it simple, straightforward, teach you the things that you need to know about it, what you can do about it. You can have choices in your life instead of saying, take this pill for the rest of your life because it's not going to get any better, and show you how you break up these patterns very straightforward, very easily. Give us a call. Our guest today, Dr. Harlan Browning, your host Wednesday evening. Meantime, 888-630-9625. That's 888-630-9625. That's how you find us here in the station today, right now. And we're talking about chronic neck pain. This is an area that has fascinated me forever because so much of what I do with all of our patients has to do with the mechanism, the controlling mechanism of the brain, the neck, as it relates to the rest of the body, because it's really an integrated piece. So when we're talking about all of these mechanisms, we have to look at the structures that are around it, and one of them is the TMJ, the temporomandibular joint. The TMJ, that, when you open and close your mouth, that little hinge on the side can be disruptive for many reasons and have a profound effect on the neck and shoulder mechanism, and you end up with pain in your neck and your shoulders and your head and so forth. Let's talk a little bit about that. How come that piece is so important?
Well, the jaw, like any other joint in the body, has to communicate with the spine ongoingly. And it communicates through a nerve called the trigeminal nerve. And I'm not going to get too into that, but to make a long story short, this trigeminal nerve has a relay station that extends down basically to the third cervical vertebrae. So there's a lot of cross-communication between the nerves of the jaw and the nerves of the upper neck and the head. So ongoingly, the jaw and the neck are communicating to keep orientation together, be it the neck and the head or the jaw itself. Because if we don't have proper position of the head, we don't have great movement in the jaw. So if we develop problems in the neck because of a trauma, degeneration, or anything else, then very often it's going to cross-communicate with the jaw to tell that there's an issue. The way the body addresses that is either have muscles become more active, hypertonic, or less active. And the byproduct is not good either way. We're going to have issues. So if we have overactivity specifically in the muscles of the TMJ, that's when the person develops, the tightness and the ache in their jaw, the inability to open it up and eat a sandwich, for example. So the TMJ and the neck go hand in hand, and very often, we were talking about this at break, dentists that do that neuromusculoskeletal dentistry won't even fit the person for the appliance till they come see us, because they know the outcome will not be as good as if they did that.
That's right. And, even with children who have dental braces put on, or adults in today's world that have dental braces on, because it's much more acceptable today, if you will, to have your mouth corrected, you have to make sure that vertical dimension is normalized, meaning that the TMJ fits properly and is in a neutral position. Any of my patients that are going to have braces or their children, I have them come in before they go to make sure that their head, neck, and shoulder mechanism are balanced, even to the point of putting cotton back into the back molar area to maintain it, and leaving our office and going directly to the dentist. And then when the dentist is done with them, make sure they come back so we have a normal equilibrium as well. It's critical, because that joint surface is so profound. It actually has more neurological input than any other joint in the body to the entire nervous system.
Well, one of the things that I do, and I know you do it as well, just to show our patients the impact of the jaw, and actually to make it easier for me to treat the person and to figure out what I need to ultimately do with them, is if I have a person come in, and I'm just going to give a random example with a hip problem, and it just doesn't make sense. There's nothing really showing up per se in the hip, and I suspect TMJ, we can put spacers in their mouth, like a tongue depressor, and then retest it, and it's often dramatic as far as range of motion and strength.
And when you're dealing with microns, you can take a piece of paper sometimes and do the same thing, so it doesn't even have to be a tongue depressor. It could be something that insignificant. We're coming up to a break. We have to be respectful of people who bring you Dr. Tom Roselle Live. Don't go away. We have much more. This is Dr. Tom Roselle. After 35 years of practice and almost 750,000 patient visits, the Roselle Center for Healing knows what works and knows how you can take control of your health and wellness. My team of doctors practice 21st century integrative medicine. Whether you suffer from chronic pain and fatigue, allergies, or headaches, we can help. Take charge of your health before it's too late. Make an appointment today. Call 703-698-7117 or visit online at rosellecare.com. This is Dr. Tom Roselle, author of Ageless Health. Health is a do-it-yourself program. My book, now also available in audio version, is a step-by-step program of how to take control of your health and wellness without drugs or needless surgery. You have the capacity to change your health and level of well-being. Take control of your health today and order Health is a do-it-yourself program.
For more information and to order, please visit agelesshealthbook.com. That's agelesshealthbook.com.
If you're looking for the best in natural health, wellness, and green living products, shop the Roselle web store on Amazon.com. You'll find a variety of products and resources that are designed to help achieve an ultimate state of health and wellness. Shop the Roselle web store on Amazon.com today. Visit drtomroselle.com and click on Roselle web store. That's drtomroselle.com and click on Roselle web store.
Educate, engage, empower. Take control of your health with Dr. Tom Roselle and the Roselle Center for Healing. Information is power. Achieve an ultimate state of wellness with Dr. Tom Roselle's Education Lecture Series video on demand. Discover how to create an extraordinary life of optimal health and wellness. Visit drtomroselle.com/education. That's drtomroselle.com/education.
Welcome back. This is Dr. Tom Roselle. You've been listening to Dr. Tom Roselle live every Sunday, 12 noon, right here on the favorite place on your dial. We do this program for you. We do this program to give you the most intimate and updated information on integrative and alternative healthcare from many different dimensions, and that's what our practice is. We do everything from a multidisciplinary approach and try to maximize the responses that you have as a person, as a patient. Love to have you this Wednesday evening as our guest in office, listening to Dr. Harlan Browning. My guest in studio today is going to be talking about chronic neck and shoulder pain, what it is, what it isn't, where does it come from, what you can do about it, how you can prevent it. All those things are going to be covered very intimately, and also give you the opportunity to talk to him and ask him some personal questions. To get that done, call 703-698-7117, 703-698-7117. Tell my staff you'd like to be there. We will confirm the reservation simply because of the fact that we only have so much space, and once we maximize that, we're done, and then you're going to make us kind of do another presentation because you're a popular guy, Dr. Browning, and we have to make sure that people have the opportunity to hear you.
We've had some pretty packed houses lately too. You know, in the middle of summer, that's impressive. People want more information, that's for sure.
And we try to do it. We try to give you the real skinny, if you will, on these subjects and tell you what you can do. You know, if you come in and you did these programs every other week, or you went online, because we have them not immediately online, but we have other programs on thyroid function, allergy reaction, and so forth. You can go on, and I think we were talking about how much they cost. They're like $3.99 or something like that, and you can listen to some of the old programs. You can come away with an education that you're going to actually be more knowledgeable about than your traditional physician.
Yeah, and then I think the important part is we always have a pretty dynamic question and answer at the end.
Yep.
And, you know, regardless of the topic, so obviously I'm talking about neck problems and problems that refer into the arm. There'll be people asking questions that have nothing to do with that, and I love it. So I think it's very valuable because it's just we're talking about a lot of different concepts, and we're allowing people to interact with us as we go through it. So it's a great night.
You know, if there's any, I'll say, other than the type of work we do, physicians, medical people out there, that you're welcome as well. We'd love to talk to you. We'd love to talk to you intimately. And, you know, after the program, we'll sit and chat with you. We'll tell you why we think what we do and how we do it. We can substantiate it. We can show you the mechanisms. You're invited as well. Please show up. We'd love to have you as our guest. You know, even if you want to challenge us on the subject, not a problem. We'd love to entertain that as well. But if you'd like to attend, again, 703-698-7117, and just tell my staff that you'd like to be with us, and I promise you'll have a very interesting experience, particularly with this guy. I mean, I sit there and listen to him, and I learn something all the time.
So you're going to be there Wednesday?
I will be there at least for a short time.
Okay. I'm going to hold you to that.
I will be there. I'll be there for a short time, and then, like I said, as soon as I get to a place where, you know, I get an overwhelm, since I've been there 5:45 in the morning, I'm done. That's this Wednesday night.
All right, at least for 10 minutes.
You know, yeah, at least for 10 minutes. Maybe longer. I don't know. You never know. We're coming up to the end of a very, very, again, impressive guest on our program, and we're going to try to do that every week for you on Dr. Tom Roselle Live. These programs are for you. They're intimate. They are what you want. Send us a note. We'll probably go over the top and giving you the information as we always do. See you next week, 12 noon, right here, same time, same place. It's Dr. Tom Roselle.
Are you dental phobic? Do you neglect your dental health because of fear and anxiety? A beautiful smile begins with exceptional dental care, and you can trust in the expertise of Soft Touch Dental Care and Dr. Michael Chung. Soft Touch Dental Care is unlike any dentist office you'll ever experience. Their warm and welcoming environment is designed to soothe fears and anxiety the moment you arrive, and they're especially pleased to pamper their honored guest patients. Dr. Michael Chung is a professional and leading expert in all areas of comprehensive dentistry, including cosmetic, sedation, neuromuscular, TMJ, and implant dentistry. Offering state-of-the-art technology, Dr. Chung can give you the smile of your dreams. Arrange for a complimentary consultation today with Dr. Michael Chung and experience the expertise that makes Dr. Michael Chung so unique. Call 703-319-6990. That's 703-319-6990. Or visit bestinsmile.com. That's bestinsmile.com.